Thank you for staying with us for the AM News. Let's start with some health-related matters. And public health expert with the Kumasi Center for Collaborative Research is warning of a third wave of COVID-19 in Ghana in the next 2 weeks. Dr. John Amwesi, who leads the Global Health and Infectious Disease Research Group of the KCCR and School of Public Health at the Kwame Nkrumah University of Science and Technology, explains there's been a minor surge in cases over the past 2 weeks in Africa, which usually would lead to an explosion. Dr. Amwesi says for Ghana, a lot will depend on how we handle the situation and how successful we get with the vaccination exercise, adding that we're currently sitting on a time bomb if things remain the way they are.
If you look at the COVID numbers in Africa, it is clear that over the past 2 weeks, there is a minor surge. Now, if you understand how COVID moves, there is always this minor surge and then an explosion. Every part of the world has experienced a third wave, and it starts just like this. We had our first, we had our second. What on earth makes us think that we cannot and will not have our third? It will interest you to know that about a week ago, I called some highly placed figures in this country and said to them that, look, from what I see from where I sit, and I happen to be privy to various pieces of data which are not in the public domain, not only in this country, but also in other parts of Africa. From what I see, I do foresee a third wave happening in the next 2 weeks or by the end of this month. All right. Now, a lot will depend on a number of factors, which is how much vaccination we can get done. There might be a little saving grace in there, which would be perhaps a proportion of people in Ghana who may have been exposed and so have antibodies to SARS-CoV-2. And this we really do not know. There are some conservative estimates based on work that we have done, that has been done, including work that my team has done, which I cannot put out right now, which suggests that, well, the numbers may be quite high. And so, you know, the vaccination numbers we need to reach to arrive at herd immunity might actually be much lower than we think, which would be very good. But again, all this is not yet being fully calculated and determined, and we're not pursuing all this as a clear agenda. Moreover, if we want vaccination to give us the best bang for the buck, then it needs to be done really, really quickly. We're doing our best there, but the vaccines are just not there. So it's just not going to happen very quickly. This is very obvious. So when you look at all these together and look at what's happening in Africa, what's happened elsewhere, it tells you that we are sitting on a time bomb.